Yesterday we did a very interesting case, and I wanna share with you. She's a 42-year-old nurse practitioner that flew from San Diego for her upper face, mid-face rejuvenation surgery. And as you see in the videos, immediately when we got into the pocket for the endoscopic deep plane, we found a lot of fillers. We found a lot of HAs. And she told me preoperative that she had multiple fillers done in the past. And you can see as you release that scar tissue, HA flows into the pocket. So usually what I do, I wash it, I clean it up as much as I can. And then the next step is after, as the pocket is developed, we're now down into the buccal space. And this entire endoscopic dissection of the deep plane is done through a small 1.5 centimeter incision behind the hairline in the temporal area. Once the pocket is dissected, now we go into the fixation. And the fixation in this case was done using rebound. Rebound is no more than a great fixation method of an absorbable material that will start dissolving within a year and giving the tissues plenty of time to heal and to stay in the position where the fixation was done. Why rebound? For many years we use sutures or cable sutures, and the problem is it's hard to get such a solid fixation just with individual sutures. Once you start using the endo-mid-face and then later the rebound, we stay with that because it really gives a long-term, solid, great result for the endoscopic mid-face and the endoscopic deep plane lift. At the end of the case, you can see that her jawline that was marked initially when she was sitting up has now been raised by about 2 centimeters. That's usually what we see in these cases where the vertical vector, it really helps to define the jawline. And in many cases like this young lady, we don't have to remove any skin like in a traditional facelift because a very strong vertical vector eliminates all that redundant skin in front of the ear. The edge of the endoscopic deep plane is eliminating the preauricular, the scars in front of the ear, scars behind the ear in young patients, and provide a very nice elevation of the mid-face, lower face, and definitely a great lateral brow rejuvenation. We did this case yesterday afternoon. I saw her this morning here in clinic. She's doing very well. We're gonna bring her back on Friday. We're gonna remove her dressings. She'll get a lymphatic drainage massage, which always helps with the swelling and some of the discomfort. And probably by the weekend, maybe Monday, she'll fly back home to California.